August 5th, 2025. Present with us is the Health Department with Pam Hanna and Matt Strozewski. Want to lead us off, Pam, on what's going on, please?
Well, I've been over at the health fair and my staff. It's been a good turnout so far this morning, and it's been pretty busy. They had some issues with how the registration was, and so some people were double booked. So it kind of got clogged up for a while, but I think we're catching up. So I don't know what it was. It was something on their end. So I'm not sure how many we have this afternoon. It's slower according to the roster they had, but I don't know if everybody's on the roster because people weren't on the roster. So, but it's a good event. They added the biometrics this year that we haven't done in the past. And so I think that's part of the adjustment that we're trying to make, is that one more thing. And we're also offering a vision screening, not just the hearing screening. So it's been pretty busy and active, and it's been fun. So
biometrics, last time they did biometrics when we did the health fair up here, that said I was overweight. That's what it said.
what the heck?
That's what my report said.
Okay, well, I
My
haven't
body
done
mass,
mine yet, but
my
I'm not
body
gonna
mass.
feel so bad when it falls me.
They told me the same thing, so
Really?
my BMI is too high.
Really? I don't believe either of you. I don't know, BMIs always get us in trouble somewhere, or I'm kind of against them. So I invited Matt to come today. Thanks for coming, Matt. Basically, we just kind of have some joint things going on with Molly. And I did get an email yesterday. I don't think you were copied on this, Matt, but from Kelly, and she spent time reviewing what was being requested of Molly. And I think that I gave you one of those last time I saw you. Kind of
I've seen it, but I don't think.
yeah, I
it's-
think Matt put this together, just kind of so we kind of all decided that these first three line items were things that she was already doing, but these other two are kind of additional. And with that those additional assignments, it was determined that she would be moved up a grade. And so that gave her a fairly nice raise. I think that I know that made Molly happy. And I think Matt and I are kind of happy that Molly's willing to step in and do that, because it makes a lot of sense to combine some of that work we're doing. And Molly has, a lot of experience that she can offer to this. So that's kind of where we're at with that. Is Molly is going to be working for both of us, and she'll mostly be in the health department, as far as that's her home, that's where she'll work. Matt's come over several times and they've talked. Molly may have to go to a Matt at sometimes, and then my staff will kind of cover our front end a little bit when Molly's out. But so there'll need to be some good communication, and we'll just be watching things. But I think it's going to be a good workable situation. My only question on the whole thing, and I think Ginger will need to be involved, is what do we do with paying that raise to Molly? Because that's not part of my budget for this year. And I did ask for less wages up front, because I took some of my wage out of a couple of grants going forward. But I think we need to kind of assess what's going on. And then, I think it, reality and fairness, it would work to have some of that come out of environmental health. So I don't know how we want to do that or look at that. One thing that I've done with my staff, because how all my money's graded, is sometimes Ginger's team will put another column on their timesheet. And so we can kind of tally hours, and it's not an exact science, but and I don't want to make it complicated, but I know, like, Molly also is assigned as the Board of Health Secretary, so she has a column for that. And so when she's doing Board of Health work, she just puts an hour or 2 hours, and so we kind of know which pot it's coming out of. And so that's an option, or simply have environmental health pay the raise for this year, and we kind of I think I'll still kind of collect some data on how much time she's spending on each job, just so we kind of know going forward, but I don't know what your feelings, and I haven't talked to Matt about that either, because we just did this
Surprise.
yesterday, but,
I'll get used to it.
Matt's learning how we work here. But
It'll all
I
work
just,
out, Matt.
yeah, it does all work out, and I don't want it, I don't want to make it complicated or anything like that, but I think in reality, we need to look at where
would-
that
I think it
raises.
would be helpful to know what kind of time she's spending doing
Okay.
each one, so at least for you,
For me, I'm gonna
To
have her
track it
track it,
and-
yeah.
and figure it out, I think
Yeah.
that would be good.
Whether we just do hash marks on a paper or a spreadsheet, or whether we actually have Ginger put it into the timesheet. I don't know what works for us, but there are some options, and I don't wanna make it complicated for Ginger, but
I would
Sure.
probably talk to her and see what
she already
works
knows
best for
I'm
her, but
complicated, so,
We have a lot of employees that have a column for each thing they do,
Right.
and that works pretty well, I
right,
think. It's
and
just
Jesse
Molly-
does safety, and he
Yeah.
does.
Molly's just gonna have to remember, okay,
All
I
right.
worked this much today for this, for
Mhm.
Matt, and I worked this much for you. or
It's not, like I say, some of it might, it might be estimation, but I
Mhm,
think we
yeah.
can get a good.
Yeah,
Well, I need to have a meeting with Ginger to look at my budget stuff anyway, so I'll just add that to my Ginger list. To ask her if she wants us to track it on that timesheet. Are you good with that, Matt?
Yeah, would we meet
Yeah.
together on it? Yeah.
Yeah, then we can kind of see. So the other thing that's kind of joint with us now is we do the monthly snapshot. And Corey, we had trouble getting this June snapshot out. It took us a little while to compile it just with the change with Megan, but then I'm usually the one that sends it out. So it's a combined effort between environmental health, our commissioner, and me. And I'm usually the one that finalizes it and sends it out. And I sent it out on a Friday, and everybody said they didn't get it, my staff. And so I'm like, what happened? So I looked, and it was stuck in my outbox. So I tried to send it again, and then it told me that nobody got it. But obviously some people got it, because Corey, you responded.
Mhm.
Yeah,
in
they-
this
they
email.
I got it.
But it was, okay. Did you get it, Matt? Did you
Yes.
get that? Okay. So I'm kind of wondering if everybody on my county list got it, but my people that I send it to outside our county list didn't get it. So I'm gonna go back and look at that closer, but I did send it on to Shane to say, why are my people trapped in, jail? Because I
Yeah.
need them to be let go. So anyway, you will see a few things on here that we didn't have available. And Corey's question was, are we still gonna try to do junk vehicles? And I threw that question out in an email to Jim and Matt yesterday, and Jim responded back that he didn't see a problem with just working with Mike to get those numbers. So I think Jim will probably be the one that does that. We're not gonna put it on yours or my plate, Matt.
Okay.
So we'll let Jim just kind of tell Mike why we're doing it, and he can work with Mike to get that number. And
Sure.
knowing Mike, that shouldn't be a problem.
Yep.
Mike's,
Probably get
good.
him on a schedule, he can give you those numbers.
Can I ask you a question on that agenda? Or I mean, yours, I gotta point it out to you because I
There you
don't know
go.
how to pronounce the word.
There's two of them, so there's one for you.
That one.
There. The hepatitis.
What is
should-
that?
Oh, that is a little thing that we don't see very often.
No, that's what I'm asking.
Yeah, but it's a GI bug.
Oh,
Yeah,
what a word for
so
that one.
it often
Okay.
comes from a waterborne illness.
Okay,
And so that's why we see it more in the summer, as people are in the water, or drinking water, those sorts of things. So I'm not exactly sure with this one where it came from as far as a source. I would have to go back and look. Tana investigated it, but that's what it is.
okay, thanks.
Did that answer your question?
It did,
Okay.
thank you.
And as you can see on our year-to-date, we don't have too many of that going on, so. We did have a couple of COVID reported in the last 2 weeks, so We are kind of seeing COVID more as a late summer kind of a respiratory thing rather than a fall respiratory thing like we see flu. So we're kind of keeping our eyes open. I know when we looked at the data across the state, some of the bigger jurisdictions, Bozeman and Lewis and Clark both had, double digits of COVID numbers. So I think we're kind of watching to see what's going on with that, and we don't really have a lot of information on what we're gonna do with, vaccine this year. Because there's all the upset with the advisory committee on vaccine practice, so. And we can't order it yet, so we don't know what they've decided. The last we heard is that it would be recommended for all people 65 and older and those under 65 with certain medical conditions, but we don't know if that's the real deal yet or not, so. We had a really successful caravan event on Friday. We joined partners with Caravan, came out, and then the clinic did sports physicals for the kids, and we did a back to school and catch up vaccines. And the clinic did 41 physicals. We saw 21 patients and administered 37 vaccines, which was a really good event. It's the best we've had since pre-pandemic. So we were really happy with that. We're trying to get Whitehall to also consent to doing a similar type of event on that end. Our relationship with the Whitehall Clinic is a little bit different in that we provide all the vaccines for Boulder Medical Clinic. They don't vaccinate, where Whitehall does vaccinate. So I'm really kind of mindful that I'm not taking their business through vaccination. So they haven't said yes yet. I've talked to them about it. But I'm gonna stop in next Tuesday when I go down to Whitehall and visit with them, talk to them about what we did in this one and, how successful is what ends up happening is Blue Cross Blue Shield covers all of the vaccine and all of the sports physical. So it's a no cost event for the families, and Blue Cross reimburses for all of it that insurance doesn't pay. So it's a win-win for them. I mean, even if we don't go down and vaccinate, which I think they might need us, because if their staff's doing the physicals, we could be with Van and do the vaccines. When we're here and we have access to our clinic, we just do them in our clinic, but we have used the caravan where we use the van as our vaccination site, and it works well. And we're gonna try to get scheduled with the caravan to come out in October to do our annual respiratory vaccines, so flu and COVID. And that'll be probably the third week in October if the van is available then. And we do 3 events, Whitehall, Boulder, and Clancy. So we get all ends of the county.
Are you getting an uptick in the measles vaccine
We've-
requests or?
We've administered probably 8 doses since it started in April in Montana. Some of those were kiddos who were ready to get it. So it's not like we've had
A big rush, huh?
a huge, rush for it. We've sent out quite a bit of information about cases. I do pretty much a weekly or every 10-day update on our social media. We get a lot of kickback from some folks about vaccinated people, but we keep doing it. It's been kind of a slow burn in the state. I don't know what's going to happen when we get back to school. That's when we'll be most concerned. And part of that is because of legislation that doesn't allow us to quarantine kids in daycares. And that's going to make it hard because those are our kids. Those are our people who are most susceptible to serious illness. So we'll see what happens. We did do, before school was out, we did do a measles tabletop with all our schools. And we had participation from everybody. So I think, we've done the work we need to do with schools, with our clinics, with our daycares to kind of be prepared, but we still don't really have a lot of, I don't really know what we're gonna do if it hits a daycare. And I've talked with Steve about it. Steve and Jim and I have had some communication Because it really comes down to how your county attorney interprets the law, what you can do. But that's where we're gonna have worry is if we get it in a daycare.
Right.
So I'm hopeful that we don't. We did vaccinate some little people this last week. That was about good. I think the other big thing that's on our plate right now, besides all these things that I've got going on with all my grants, we are trying to get prepared to hire a behavioral health coordinator, and that'll help with some of that. But I just got a copy back of our strategic plan. Got a couple of them I can leave with you. So this was something that I did pretty much through Pathways. And we funded it through Pathways. So this is what our department will be working on for the next 3 years as far as an improvement plan. So I had Natasha from Mountain Time Design do the layout for this because she's the one that Yarrow hired to do the graphics on our Chonship. So all 3 documents now look the same because they've got the same designer. And she only charged me $200 for the product, which I thought was
Pretty cheap.
good. Yeah.
Mhm.
So anyway, when we did the strategic planning event, we had Montana DPHHS System Improvement Office come out and work with our staff for a day. It was a day-long workshop. So there was input from all 5 of us on what we were seeing, what we were needing. And this is what we came out with for that. And so there's a timeline at the back that kind of has some goals and strategies for what we'll be working on. So the first year is laid out in quarters, and then year 2 and 3 will have to come back to the table and do a calendar, kind of based on what we've accomplished and what still needs to be done, or new needs that come up. So we'll work with DPHHS again at the end of this year to look at what we do for year 2. And then we should be pretty much in line with the strategic plan with our township. So, you know, all 3 of them would be kind of done simultaneously every 3 to 5 years.
That's great.
Excuse
Because
me.
you remember I'm retiring.
What?
You remember I'm retiring in a
You find
couple
your
of years.
replacement, right?
In a couple of years.
Find your replacement?
Well, that's another thing we should talk about is how do we do that so we don't have a gap.
Couple of years is left to do.
We don't want gap.
We don't need a gap. We've done gaps.
Maybe we can have Matt do it for a while.
You know, Matt's in training. Matt can do it all.
Jack of all trades.
He's only got 25 hours though, so you're gonna have to hurry.
That's better than I thought you had.
We'll get it done.
You're
We'll
getting
figure-
there.
We'll figure a way.
Yeah. No, Matt's a good partner.
Yeah.
On the community events, I mean, just an example, I know things are sort of small and stuff, you don't know that, do you, in the sense of the health department because of the fair down here a few weeks later?
Well, what we kind of determined is that we can't, we really, with as small as we are, can't do every
Right.
single event that happens, because there's Basin Days and there's Jefferson City Days and there's all kinds of days. So what we've determined is that we do the 3 big events.
Okay.
So we do Clancy Days in June, we do Frontier Days in July, and we do the fair in August. And then we have been doing, once a month, we've been going to the farmer's market.
Oh, okay.
Here.
That's right.
It's pretty easy for us to take, you know, 1 or 2 people half a day. But what I've insisted that we do when we do any of these events is that we provide some sort of education or knowledge on services that we provide. So when we did Clancy Days, Jesse was the main person. Jesse and I covered that one. So Jesse's really talked about the emergency preparedness and, you know, getting people signed up for Code Red. So those were the things he really focused on. Molly and Tana went to Whitehall. And so they really focused on CPR. We had our hands-only mannequins there and got some people signed up. And then Tana's big thing is maternal child health, so we did a lot on safe sleep. And then at the fair, Aaron and I will be the main ones there. At the fair, it seems like everybody kind of comes and goes, but it'll mostly be Aaron and I. So I will probably be doing something related to mental health, most likely talking about this combination of 911, 988, and 211. And then Erin usually does something on car seat safety because she's a car seat safety person. So then we have a no cost raffle that we do. So we have 3 or 4 prizes. And if people engage with us and talk to us about one of the things we're doing there, they can put their name in a raffle. And we gave out prizes both at Clancy Days and at Frontier Days, and people like that. I mean, it gives them an opportunity to talk to us and for us to talk to them about our services and for them to see we're nice.
Incentive, yes.
Yeah, and we had a really good turnout at Whitehall. I don't have an exact number in my head, but we had quite a few people enter the raffle.
There's a big
So
crowd
not
there.
quite so many in Clancy, but we usually are inside the building,
Oh,
which
sure, right.
limits some of your activity. And then we'll be on the grass at the fairgrounds, so we get quite a few people then.
The other thing I would ask is how's it working out down there in Whitehall, the old town hall building for you guys?
Great.
Yeah.
Tana loves that building. And one of the other projects that we did with our pathways is to do some rebranding. So that new logo that you see on the front of the strategic
Saw that.
plan, we're trying to get that on our letterhead and our door signs, things like that. So people recognize us, you know, it's a
So
visual
shirts and everything
record.
too?
And
Yeah.
we're doing our shirts. So we did flags like that. And
Oh.
so each of our offices has a flag that we put out when we're open.
Oh,
So we hang a flag at Whitehall right on so
Wow.
people kind of are starting to associate us being there with when the flag's up.
good idea.
And Clancy's the same way. And we have one in here in Boulder too. People have a hard time finding us at the Boulder office because we're kind of on the side. So I think the flag helps identify us. And then when we've taken pictures of those folks that get raffle prizes, we've been taking them in front of the flag. It's kind of another way to kind of. So we're really working on being a little more public facing and
Public relations.
improving our presence. So we also gave out gift cards at our vaccine event, so the kids were pretty excited about that. If they had all of the required or recommended vaccines, they got one raffle ticket for each vaccine they had.
Mhm.
And so the better vaccinated you are, the more options you have to. So we had 4 kiddos that got gift cards from that event. So they came yesterday and picked up their stuff. So
Very, very active.
any more questions for me or concerns or?
West Nile virus.
It is in Helena and a couple other places. I put out some information on our social media the other day. There was some kickback. Why are we doing this? This isn't in Jefferson County. And somebody said, because we go to Helena. It's like, so yeah, I mean, we just need to be aware that it's out there and be doing some protection. I know the mosquitoes have been worse at my house than they have been in a long time, so.
What are the symptoms and?
Symptoms are
Procedure.
usually a fever.
Okay.
It's malaise, that kind of stuff. So sometimes it's not easily detected because it looks like something else, but a lot of adults don't get a fever in the, over 100.4. So it's usually a higher fever, which is usually a pretty good indicator, to look for something like that.
Is it treatable or?
Yeah. Mhm. Yeah.
Good, another one made its way to us, huh, West Nile
I know, we're so lucky.
and.
I swear, poor Tana, she's had more odd disease investigations than we've ever had. I don't know what the world is like now, but she has, so. And that's another way that we work together in environmental health and the health department is that we do some combined work on some of these disease investigations. So, you know, the dog bite, the animal bites, we work together on those. Generally, if it's a disease, if it's the people, that's the health department taking care of it. So if we get notification that somebody's ill, it's gonna be a nurse that talks to them.
So if the person bites the dog, then it's you.
Right.
If the dog bites the person.
But
it's
then
Pat.
environmental health will deal with, you know, the animal, or if we've got a water or foodborne illness in an establishment, then environmental health is gonna go in and take care of the establishment. You know, we don't do that part of it, but that's another place where we really do a combined effort and work together.
Good.
So we're really excited. If I could just put Matt in my building, that would make us even
You
better.
fit in
but-
your office with you.
He's pretty quiet and calm. He doesn't take up much space.
Pat's getting me a sign for my office. Well, I'm good to go.
So anyway, you know, my dream is building expansion to put all of us together someday, so
That would be nice.
that would be nice. Did you have anything to add, Matt, or?
Yeah, I just want to thank Pam for letting me tag along and see how this all works here. Few things, you know, what's great with Molly, she started in kind of part-time work last week, answering phones and handing out forms, which that was big.
No, I bet.
I don't have to sit on that phone all day and I can get out in the field and do inspection, so. That went well. I'm happy to help out with wages. I think should be no problem.
Well, I'm retiring in a couple of years, you know? Just so you know.
10.
So Van Puckett, our contractor, through Southwest Montana Consulting, he's been doing great, helping me mainly on septics right now, pretty much that's all it is. But he'd asked if he could come meet you folks at a meeting sometime, so I'll bring him along.
Yep.
Get to meet him. And then we had talked about possible septic related fee increase and a spreadsheet. I got that put together.
Yep.
I'm giving it to Jim Murphy for the health department meeting next week, so get through them and then move on to you guys and see what you think on it.
Sure, sounds good.
But that's about it on my end.
Good. Do you have any problems at a concert after it went along? I mean, anything you had to shut down or any of that kind of stuff? No, not at all?
Everything, the water. Two people running, they've been doing it for years. One is taking care of the water,
Oh, okay.
the chlorine in it. And he keeps me up to date on a
Hmm.
daily basis, does a really good job. And the food vendor, individual, she is spot on. So, yeah,
Good.
no issues there at all for us.
Great.
All the questions I got.
At the end of the month, we're gonna meet together with our McFEP group, which is our multi-county public health emergency preparedness group, so it's our surrounding counties. And Anaconda Deer Lodge is part of that group. And so I think we're gonna ask their public health director if she'll talk about their incident that they're involved in now. With our group, just so that we can kind of share information, and that's part of what that group does, so. I haven't heard back from her, I'm sure she's busy, but we'll try to kind of look at that and like what we might do if we should encounter something similar.
Yeah, that's a tragedy there.
It is a
Yeah.
tragedy.
Mental illness. Sounded like he had something that should have been taken care of, but nobody could do anything because he wasn't that far yet or something. I'm sure that law enforcement sees that all the time. How do you know?
Yeah, I think, you know, the other thing we need to try to advocate for is gun policy. I mean, why did he have that kind of a gun?
Well, he never did.
You know, I mean, that's part, I mean, mental health is part of it, and but we also have to look at access,
Right.
you know, so there's a lot to look at in a situation like that,
Yep, for sure.
so. I saw, 3 Great Falls troopers head that way this morning, so I wondered if they're going out to help.
Sure.
Does Doug have the drone out?
They probably got several drones over there. I don't
I'm
think they've,
sure.
they've commissioned ours yet.
Oh, Doug was down here by the fire hall when I came through this morning on something.
Well, I'm wondering if some of the bigger communities have a little more availability to send people to help. but-
Oh,
Anyway, didn't mean to end on a downer note, but is there anything else? No?
I don't think so.
All right, thanks so much.
yeah. Thank you guys.
Are we the
Appreciate you
last
coming out,
one, or
Matt.
you guys got a whole day ahead of you? Yeah,
This is our
You're it.
slow day today.
Man,
Sometimes we don't have any agenda items in the afternoon, so we
take
just
naps.
canceled the meeting and.
Yeah.
No use showing up for nothing to talk about, so.
Come out to the health fair,
I'll be out there in the morning.
get your health stuff done.
I'll be out there in the morning. So you tell me I'm overweight.
We'll see how fit you are. I thought they were gonna tell you you were tall.